Running is a chance for me to relax. It's a chance for me to think things through in my head, plan for the day. It's a way for me to feel energetic and healthy and active, which are several things that I feel like make up who I am. In 2013, I was about to get married, and before leading up to the wedding, I'd been working out and getting ready. And I guess it was on our wedding day especially. I noticed a little bit before, but not a lot. And I had a tighter fitting wedding gown on, and looking at the mirror from the side, and noticed that I had this bulge in my abdomen, and didn't think too much about it, but just knew that something didn't seem right. They did an ultrasound, and they noticed that I had a mass that was on my ovary, and it was about the size of a small grapefruit. Dr. Tillmans read the scans along with the radiologist there at the West Cancer Center, and decided that it would be best for me to go ahead and have surgery the next day. The medication had started wearing off from the surgery, and that was when Rusty told me that I had stage 3C ovarian cancer. My cancer diagnosis was in 2013. I had the one surgery followed by 3 rounds of chemo, a second surgery followed by 3 more rounds of chemo, and at that point thought I was finished. And just 5 months later, we found out that I had a reoccurrence. We decided that we were going to try a new innovative procedure called HIPEC, which is hyperinterperitoneal chemotherapy. And before that time, HIPEC had not been done with any other, or very few, ovarian cancer patients in the city of Memphis. So it was something new, cutting edge, and the question was, did I want to try it? And it was like, yes. Well, of course I want to try it. I was super excited, and still am excited to be one of the first patients in the city of Memphis. And from what I know in the country, there aren't many studies yet of ovarian cancer with the use of HIPEC treatment. So I feel like I got to be one of those first people, and I feel very fortunate.
It began with a small 2-room clinic in downtown Memphis, Tennessee. Dr. William H. West was a nationally respected oncologist and lead investigator for the National Institutes of Health in Washington, D.C. A Harvard undergraduate degree, coupled with a medical degree from the prestigious Johns Hopkins School of Medicine, meant that Dr. West could go anywhere, do anything. Yet, he returned to his hometown of Memphis.
I was one of 4 children, so our mother was fairly important to our lives. So when she had a mastectomy in my senior year in high school and died as I graduated from college, I was commissioned. There wasn't even at that time perhaps a field known as medical oncology, but that's what I was going to do.
And in 1979, this goal became reality, and the doors of what would become West Clinic officially opened.
It was my great good fortune to meet Kurt Tower when he was an intern. I recognized instantly in the first patient we shared that he would be a great medical oncologist, and encouraged him to go to New York. In New York, he met Dr. Lee Schwartzberg, and both Dr. Tower and Dr. Schwartzberg made the decision to come back and join me here in Memphis. And that was really the kickoff of the West Clinic.
Building on the 35-year legacy of unparalleled patient care and cutting-edge treatment, West Clinic announced an innovative partnership with Methodist Healthcare and the University of Tennessee Health Science Center to form West Cancer Center in 2012.
The rapid progress in the area of cancer research demands teamwork. It demands that each patient have the very best input from surgeons, from radiotherapists, from medical oncologists, from research. So this cancer center will be successful because it will bring those resources together to address the needs of what is still our most complex disease. Cancer is so profoundly complicated. And it's just so exciting to me to see new insight into what makes that cancer work. That's the driver of the collaboration between the West Clinic, the University of Tennessee, and the Methodist Hospital.
Today, West Cancer Center delivers the best comprehensive cancer care to more than 30,000 patients each year. Our physicians and scientists are leading the rapid innovation taking place in the field of oncology care. We are hiring scientists. We continue to recruit the best oncologists in the country. Together, we are fighting the war on cancer.
There's just a tremendous amount of goodwill in the city for the West Clinic, and that reflects the good people that we recruited to the West Clinic. And I'm not talking about just the doctors. I'm talking about the pharmacy techs. I'm talking about the nursing staff. I'm talking about the volunteers that greet you at the door. When you bring that, if that's the beginning of your cancer center, you've got something very different than any other cancer center in the nation.
The tradition says to ring this bell 3 times well. It's told to clearly say, my treatment's done, its course is run, and I am on my way. Here's to my next chapter, cancer-free. Cheers.
There's rarely a time that I run that I don't think, how happy I am to be in this place now, where I'm every day getting better, every day I'm getting stronger, and I just want to keep pushing myself to see what else there is. Fight on means to me never giving up, and that was something that the West Cancer Center never did, never gave up on me. Through all this, they were always by my side, even to the point that in the first Ride to Fight On this past year, Dr. Tillmans and I both fought on together, riding in a bike ride to raise money for research.
They have our back. West Cancer Center has done the world for my child, and there is no way I could ever thank them enough.
You've heard Kate's story. There are many Kates who need to know we're bringing some new ideas, who need to know we have research opportunity, who need to know there's something we can do that perhaps will make the difference they need. There are still too many women experiencing breast cancer and ovarian cancer that need new ideas, and we want to be sure we bring the very best ideas to Memphis. An important point to remember in this fundraising, not a single dollar is going to building a new building. It's all about people. It's all about bringing new talent to Memphis.
With your generous commitment, we will ensure that patients like Kate have access to the most innovative research and effective therapies possible. Join us as we make Memphis the destination for adult cancer care and research. With your commitment, you are transforming the way the world treats cancer. Fight on.